Hello, everybody. Today is Friday, December 18th. Welcome into another Keep Boone Healthy Community video. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce. Happy holidays to you and yours. Thanks for joining us for this very important conversation as we have discussed several times and across several different channels over the last few days and weeks. Vaccine deployment is on everybody's mind here as we continue to fight COVID-19 in our community and really throughout the country. And we wanted to take a few moments to talk to some of our local experts who have been deeply involved in the planning and ultimately the deployment of vaccines as they come to our area, to give you an idea of what to expect and how this process will go and how you can make sure that you are staying up to date on information regarding to Watauga County and the high country's vaccine deployment standards. So with us today, President and CEO of Appalachian Regional Healthcare System, Chuck Mantooth, also Jennifer Green, Director of Public Health for App Healthcare, covering 3 counties here in the high country. So thanks to both of you for joining us, and congratulations, I think, to getting to this step now. I don't know if congratulations is the right word, but I know that there has been a lot of work behind the scenes to get your 2 respective organizations ready to begin helping people, first frontline workers and then everybody that gets put into the slots after that. But Chuck, I guess we'll start with you first. Press release a few days ago that Appalachian Regional Healthcare System would be getting the Moderna vaccine. Can you tell us a little bit about what went into that whole process and what you're hoping to do with those first 800 doses that will be coming to the way of the hospital system?
Sure. Thanks, David. First of all, thanks for hosting this. And it's a great way to get information out. So hopefully that whoever views these videos can pick up a little bit of information out of what we're talking about here. But yeah, we're really excited. I don't want to overuse that word, but if you really look back, I guess 9 months ago when we first, that fateful Friday, on Friday the 13th in March, we were all kind of really thinking this thing is real and it could affect us. A lot of uncertainty, a lot of discussion was put on the development of a vaccine. So really it started way back in March. So if you take that 9-month period of time, fast forward today, there's a lot of excitement building, especially on the part of ARHS, to think that there's some, hope in the form of a vaccine that's coming. So to that point, I'll walk through a little bit of kind of what we saw in the background over the last few weeks. We were always watching kind of who was going to get in front of the FDA first and what vaccine was going to be approved. And obviously Pfizer was the front runner there and Moderna's right behind. So we thought early on that we would probably get the Pfizer vaccine, and that's through just listening to what the federal government was saying and also working with state officials and then working with the health department too. So we went ahead and purchased a freezer, one of those negative 94-degree Fahrenheit freezers, and it just got here yesterday. But turns out that we may use that at some point down the road, but we were in the 2nd week of allocation of vaccines. Pending that Moderna's approval today by the FDA, we are already in the queue to get 800 doses of that vaccine next week. And there's a lot of work on logistics as far as how it gets here, how it's stored, how it's given, who do you give it to, when do you give it, how do you get all those monitoring things. So we've done all of that work. Our team has done a fantastic job. I mean, hands off to them. I can't name all the names, but Sean Burrows is our head of pharmacy, and he's really kind of been at the tip of the spear of all that work. And obviously you want a scientist working, leading us. So he's been organizing all that work, and we're ready. As soon as we get it next week, we've got vaccination clinics set up. We're going through a process of identifying people, notifying people that it's available. Go ahead and start scheduling next week. And really that's a closed, I guess, clinic. And it really, because of the way that the state has defined the order of who will receive the vaccine, those at highest risk, like nursing homes, and those on the front lines, like healthcare workers, especially those in our emergency department and those treating those COVID-19 patients, really are in line first for the vaccine. So we followed the process that really was defined by the state with guidance from CDC and the FDA and others that really kind of set that prioritization of who should receive the vaccine. So that's the first step. There's a lot of uncertainty, and Jen, you may want to comment here about what happens after that. And that's where probably, David, most of the questions from the community are going to come, when do I get that vaccine? But for right now, we're focusing on the present. Next week, when we get the vaccine, we feel prepared to go ahead and administer those 800 doses that we'll receive. We did upload about 12 to 1,300 names that we felt like were in that priority list. So if everyone takes it, we won't have enough. But we're anticipating that some won't take it. That's the process that we're working through.
Well, thanks for that intro to this conversation, Chuck. And Jen, I'll ask you the same thing from the health department's perspective, because I know that you all have been, just like the hospital system, working through the procedures with the state to get allocation of vaccines, not only for here in Watauga County, but for Ashe and Allegheny as well. And then to Chuck's point too, if you want to get into some of the what comes next conversation, because I know that's on a lot of folks' minds right now about what becomes of phase 1B and on from that point.
Right. Well, thanks, David, and really appreciate being here and being here with Chuck as well, because this is a community partnership, and we are very committed to working together to try to get our highest risk individuals immunized first. So we are expecting to get 600 doses of the Moderna vaccine on Monday, as well, pending the FDA approval and the information that we are anticipating to receive over the weekend. And our staff really have been focusing in on long-term care facilities. There is a federal long-term care program that many long-term care facilities have participated in, but some have not. And so our goal is outreaching to them to make sure that they get first in line for our initial doses. Group homes, assisted living, or nursing homes that were not part of the federal program are who we are going to target first, both residents and staff, because we know that they are just a vulnerable population and at high risk. Moving on from there, really, we've been working to try to do some outreach to healthcare providers who are at higher risk. So folks like dentists, people who are working in funeral homes with decedents, people who are doing emergency medical care for people in medics or as a paramedic. Those are the other individuals that we are trying to make sure we get outreach to. And of course, working closely with our hospital partners to make sure that all the frontline healthcare workers in our community get initial access to the vaccine. Moving on from there, really, we're going to continue to monitor our vaccine together and stay in communication. I think that what we'll see is how we progress through the phase 1A. We will do that together collectively and really be checking on each other to see, are we actually through 1A? Have we immunized everyone that fits into that category? And of course, stay in step with the Department of Health and Human Services guidance before we move on. But the next phase will be really looking at people who are in frontline positions and also people who are at higher risk for COVID due to chronic conditions. So if you think about people working in retail, transportation, some government employees, perhaps some other healthcare employees that are maybe not at the highest risk, but are at higher risk because of their work, and they have 2 or more chronic conditions that put them at higher risk for COVID. Or severity with COVID-19, that's really who we're going to be targeting next. So our goal is really to try to put out some additional information. And I know that folks are really interested. I just want to remind everyone, we still have our website and we have our call center that is still in operation. And we have folks who are ready to take questions that you have.
Chuck, I think that what Jen has laid out is very appropriate information to help folks understand what goes into some of these categories, and we'll get into that conversation about state guidance and how they dictate information to you all here in just a moment. But I think going back to the conversation of frontline workers a bit for this 1A group, we're not necessarily talking about just doctors and nurses with this either. There are a lot of folks I know that go into making critical operations work within the hospital system. Can you touch a little bit about what that 1A category might look in your setting to make sure that, again, hospital operations continue outside of treating patients for COVID, that you can run the facility and make sure that it's available for all who need care at this point?
Yeah, sure. And that's really a relative small group of folks compared to the frontline folks that are actually on the front lines that have that face-to-face contact with the community, whether it's a known COVID patient or not, but it's always suspected there, and we have to act that way. Yeah, but really this goes back. We've been in emergency management, incident command type mode since March. I mean, it really is we've been in those situations before for different reasons, but those are usually short-lived, a power outage or something, some kind of disruption, and it's over in 24 hours. We've been doing this for 9 months. And so we've been pulled a lot of people that are engaged in that response, because really we're making decisions. It used to be daily, now it's kind of hourly on different toggling through how we manage our system here. So as to make sure that it's a coordinated effort, we've brought a lot of people in that are crucial to that incident command response, and we want to make sure that we include them in that first group to make sure that they're vaccinated also, because even though they're not crucial to that one-on-one patient experience, it's we got to make sure that it's coordinated, and we want to make sure we keep those folks safe too.
Excellent information there. Jen, as we talk about the general public certainly having their questions about this and where they fit in, you mentioned that frontline element to the next phase of this, which I'm assuming is phase 1B. First off, how do you get to phase 1B from your administrative standards? When do you get to kind of drop the ropes on that? And then for those frontline business employees, what is the best way for them to organize themselves a bit so they can provide good information to the health department or the hospital system, whoever that may be, about who's on their list of folks that they might like to see get the vaccine when it becomes available to them?
So I think the speed at which we get through our first phase will be very much dictated by, really how many people we are immunizing in that first 1A group and how much vaccine we have collectively. So that's one of the things we're going to be working on together, is trying to make sure that we feel confident together that we've gotten through all of the folks who are at the highest risk first. So it's hard to have an exact timeline, but I would say at least for the next couple of weeks, we're probably going to be focusing in on the 1A population. But moving forward, businesses can be thinking ahead. They can be thinking about if you have frontline employees who are serving the public and who have chronic health conditions, start talking to them now by sharing information about the vaccine. One of the most important things we can do is make sure people have credible information about the vaccine. And the Department of Health and Human Services has a lot of information posted. We will continue to update our website, and of course can maybe ask you to come, if we can come back and update some more on how businesses can be thinking about getting registered. We will be opening an opportunity for folks to do that. But at this point, really what's best is to try to share information about the vaccine. And I think be thinking ahead. If you have people in your operation that are frontline workers interacting with the public and they have chronic health conditions, start thinking ahead about how you could gather that information, because that's really how we're going to be asking for that in the future.
Well, and I know there's some significant language being discussed at the state level, and you're starting to see it work out now about, just the thought process around getting the vaccine when it's your turn. And there's not really a way for anybody to jump the line, so to speak. There are so many different protocols and procedures that you both must go through to kind of check off the list of saying, okay, yeah, we have officially moved through 1A. We are ready to move forward. Can you both speak to that a little bit and what your skin in that game is from being able to get the vaccine to also knowing that you've got to fall under some pretty strict guidelines of deployment to make sure you get the next batch of vaccine and so on and so on?
Well, Chuck may want to add here, but we as enrolled providers, we have really strict guidelines that we have to follow, including how we vet the list of people that are in the first group. And as we move through the groups in the different phases, that is really managed very tightly and requires us to communicate together to see where we have gaps that we identify, but also to ensure that we are moving in step with the Department of Health and Human Services before we move on.
Yeah, I think Jen, you said that. I mean, that's perfect. And then the enrolled providers for us will expand over time as we move this into our doctor's offices. So there's where you're starting to get into, the folks that are in phase 2 and 3 as you work your way through the list. So, but because we expand that, it makes it a little bit more difficult, but to manage. But we're all still held to that pretty high standard that we're working, in lockstep with the state and our local partners here too. I mean, the key is, have an efficient system to when we get an allocation to this jurisdiction that we administer it. We say we've done it, and then we can communicate that back to the state so they know we're ready for the next allocation. So efficiency is going to be the key for us. And that just really kind of speaks to it's a coordinated effort. I mean, Jen and we have to work together along with the folks in Avery County too, to make sure that we're speeding through that list as quick as we can.
Final question for both of you. I know that there was an article in the Watauga Democrat here locally recently about just the overall, I'll call it wear and tear on frontline staff here over these last 9 months and what their perspective has been. Now that we are about to reach a new benchmark in this whole entire COVID-19 process where again, we see light at the end of the tunnel, but the tunnel still has a little bit of runway to it. How has just even the conversation about vaccine deployment helped in any way, maybe provide a little bit more inspiration to a group of folks in our frontline healthcare workers that have just been through it here over the last few months?
Yeah, I don't mind starting. I mean, I think that, it's hard to measure that, David. It's just that, but you can walk through the halls with a mask on and just the conversations that you had, we had with folks a year ago versus the conversations you're having today have a different tone. I mean, these folks in the health department's the exact same way. I mean, it's very stressful when they come to work, but then they go home and they may be dealing with a spouse that doesn't have a job or school-age children that now they have to turn their attention to helping work through the school day. So, I mean, it's excruciating for these folks. And I mean, it's been hard for I think our entire community, but especially hard for the folks that are come to work and then they're just it's in their face every day. So it's been tough. But on that vaccine, I think that the really key is this to always have a little bit of hope that tomorrow's going to be a little bit better. And when we got word of the vaccine, I think we could feel a little bit of a relief here that even though it's not been distributed yet, that hope is on the way. So that's been our experience. And the last thing I want to mention, David, is for me personally, I don't want to let them down. They don't want to let their team members down. So there's been this little bit of a coming together that really kind of boosts everyone's morale here. So that part's been a neat part to be a part of. I can't wait to the day we look back and say, oh, look what we did instead of look what we're doing. So that'll be really, really nice.
Very good point. Jen, do you have anything you'd like to follow up with that on?
No, I was just going to say, well said, Chuck. I look forward to looking back and seeing that all that we've accomplished. This is one of the things we're trying to tell our staff is we are living history. I don't think we've been through a time like this. And though we all prepared for the what if scenario, I don't think any of us imagined it lasting this length of time. So our staff are really tired. They're tired, but I think what we can all do is, take a minute to really reflect on what has all been accomplished this year and commit back again to our prevention efforts and trying to protect the healthcare workers who are trying to take care of us in the hospital and the public health workers who are just worn out from months of case investigation and contact tracing. but also look ahead at the next year ahead and see that, there is light at this very long, journey, and we're going to be able to work together and get as many people immunized as we can, and do it in a way that we can feel proud about at the end of this long journey, and really protect more lives. And that's really what we're here for. And I think, never in any time have we had an opportunity to really lean into our purpose of why we exist as much. And that's really something to hang on to and take away right now.
That's very well said also. And I think a lot of organizations that have been dealing with the immediacy of COVID-19 operations have said the same, that it does give you the opportunity to exercise the things that you've had in your plan, and find that purpose once again. But I know that we're all looking forward to a time, as Chuck mentioned a moment ago, that we can talk about this in the past rather than in the present. So on behalf of our entire community, I thank the two of you for leading your organizations together so well with this critical step of the journey now approaching us, to just simply know that we're in a community where our hospital system and our public health agency communicate so well together and have got a plan for this. I think that can give us all reassurances here locally that no matter what we see or read about other areas of the country or the state, here locally, there's a good plan in place. There are good people leading that plan, and hopefully this will lead to a successful deployment of the vaccine for those who want that. So thank you again for all you're doing, and we extend an open invitation to you both at any point in time. I know we'll be talking about this quite a bit through this channel over the next several weeks, just to keep people informed. Anytime you've got anything you'd like to share, we're here to help you do that. So thank you for your time today.
Thank you, David.
Thanks, David.